What's been your experience of using Botox and fillers?
I have only one thing to say to them, that Botox is good. It relaxes your wrinkles. It makes you look younger. Straight away, you look years younger after applying it. But if you start very early, then what happens is you have to continuously use it.
What's been your experience on supplements overall?
I'm a big supplement user.
Okay.
Magnesium takes part in almost 300 enzymatic reactions in the body. We know that.
Okay. I feel fasting actually has a scientific base. Religion is only used to implement it.
Of course, you're right. You're absolutely right.
Welcome back to Exceed the Brief. Today we are tackling one of the biggest obsessions of our time, aging. We can't stop the clock, but science, medicine, and lifestyle hacks are telling us we might just be able to slow it down. With me today is my dear friend, Dr. Sunita Banerji, a family physician turned anti-aging expert with years of experience in natural hormone therapies, skin health, and wellness medicine. Thank you, Dr. Sunita, for being here with me today.
Thank you for having me.
So tell me, how was the experience of being part of the AFMC ecosystem? I know AFMC is largely male-dominated. What was the ratio at that time, and how was your experience of studying MBBS and doing your DGO at that time at AFMC?
Okay, so the experience was wonderful. And those days, there were many more boys than girls, obviously. There were 80 boys in every class and 20 girls.
Wow, you must have been really sought after.
Well, I think all the girls must have. Since there were so few of us.
Well, that it's a good position to be in, I guess,
It is.
Yeah. And then you moved out of AFMC in 82 and you started your private practice in 1989. Is that correct?
Yes.
And you came to Mumbai and started your private practice,
Yes.
right? And then after that, you got trained in London about 18 years ago in the whole area of health aesthetics. And you focused on major problems that we are facing, which is lifestyle, health, beauty, and aging. Is that correct?
Yes, that's correct. So I was practicing briefly as a gynecologist before I got into my family practice.
Okay.
And the rest is correct.
Okay. And then was there any influence at that time that made you pivot from being into family medicine and then going into anti-aging or aesthetics?
Okay, so when I used to treat my patients, I realized somewhere that I could only treat them very symptomatically. I wasn't doing anything to enhance their quality of life.
Right.
And so that created a little lacuna in me, and I wanted to be able to do that. And so I met a doctor trained at Howard, and with him, I could understand a lot about anti-aging medicine, about bioidentical hormones.
Is this Dr. Ali?
Yes, that
Okay.
was Dr. Ali.
Okay.
So that's how I got more interested in anti-aging medicine.
Okay.
I was already trained in aesthetics,
Right.
but I didn't want to keep it only at that. I wanted to go in a little deeper.
So you're saying you didn't want to limit yourself just to the skin, but go deeper and make a difference not just on the surface, but even at the core.
Yes, definitely, because anything that's on the surface has to be supported with something from the inside. Because the outside can't last
Right.
if the inside is not optimized.
Does not support it. Perfect. And I know you've been attending international anti-aging conferences for the last 15 years. I think you have lectured in Bangkok, Malaysia, Bali, in India. I think Goa has been your regular destination to lecture. Why is Goa such a hot spot for anti-aging?
I think because all the other anti-aging doctors love to come to India, and there can't be a better place than Goa.
Okay. So I'm looking forward that the next part of this conversation should have, we should have the next part of the conversation in Goa maybe.
Why not?
Yeah.
In fact, I'm going to Goa next week.
Okay. And now I know your focus has moved, which includes nutrition, weight management, you look after skin, and we'll demystify this whole area on Botox and fillers. And especially you mentioned about bioidentical hormone replacement therapy or BHRT. Is that correct? I mean, that's the area that you focus in now?
So I focus on all these areas equally now.
But how much of your time, moves away from regular family practice towards this? So don't your patients who've been with you for 35 years still want your time as a family physician, or you are able to divide your time between family practice and anti-aging?
So if someone comes to me for a minor symptom, I immediately convert them and talk to them about how they can improve their health. So I talk to them about anti-aging. Whether you come to me for anything, I take them along that path.
What's the average age of people who come and see you? Typically, are they young, middle-aged, old? What's the typical age group of people that visit you?
So I have people visiting me from the age of 20 to the age of 80. But what I want to say is that the younger ones come more for the outer, the physical appearance.
Right.
Whereas the older ones come actually for improving their functionality. But I'd like to say something, that aging begins in our late 20s.
Okay.
So that's something that they have to understand. Then the symptoms start in the 30s.
Okay.
And then in the 40s, they start getting diseases, maybe chronic diseases, chronic inflammatory diseases, which we're seeing so commonly now, which is the biggest thing in the 20th century. So if you want to anti-age, you got to begin early. That's something they have to understand.
Okay. So it's not something only after you turn 50 or 60 that you think about, but even in your 30s and 40s, there is a role for anti-aging.
Definitely there is a role. And the beauty about the body is that even if you start it later, you can still optimize your health.
Okay. So you can catch up.
Yes, you can catch up.
So I know the anti-aging market is estimated to be, almost $85 billion and going to surpass $100 billion. But tell me, why has this suddenly become such a big buzzword? I think it's a very recent phenomenon, maybe last 10, 15 years, that people have been speaking about anti-aging. Aging is a natural phenomenon, right?
Yes.
Then why do we want to talk about anti-aging?
Okay, so as you said, aging is a natural phenomenon. We all age. We can't prevent that. But how we age can be prevented. And so therefore, I want to just explain to you that anti-aging medicine, most people look at anti-aging medicine as only the outside. Right? Just cosmetic, just your skin, your hair, Botox, fillers, etc. But anti-aging is actually more about the function of your organs from inside. So the reason it's become such a buzzword today is because people are living longer and they want to live healthier. And they understand that through anti-aging, that can happen. They want to be able to travel, they want to be able to, play with their grandchildren. These are the two most things that come to my mind, which as we get older, what things that interest us.
And you do both, right? You have 2 grandchildren and you travel a lot.
Yes, I do both.
Yeah.
And therefore, I have to remain in perfect condition.
Your best self.
My best self, so that I can enjoy it. Right now, in the olden days, we were living for shorter time. But these days, because we are living longer also, the chronic diseases start coming on. And what I've noticed in my 35 years of practice is that when one chronic disease comes in, slowly the other ones start coming in. And before you know it, you're on 4, 5, 6 medications. So that is one thing that does happen. The other reasons are because the beauty and the wellness industry has become so large today. There are new supplements, there are new beauty products being launched practically every day.
Right.
So that's the other reason why everybody knows about it. And lastly, there's a lot of scientific research being done. You cannot imagine how much research is being done in the anti-aging field. So all that put together has made everybody talk about anti-aging.
There are 2 points that I picked up from this conversation that you said. One is people are living longer.
Yes.
So let me just ask you, that's lifespan.
Yes.
And then there's another word called healthspan. So tell me, what's been your experience of bridging this gap between, people live longer, but their health sort of, sort of does not keep up to pace with the lifespan. So does anti-aging actually help bridge this gap between lifespan and healthspan?
Okay, so that's a very good question because, you can then understand what exactly happens. So our life, the years we live, is called a lifespan. Then you have something called the health span. That's the number of years we live in good health, in optimal health.
Right.
Right? So modern medicine acts at that level it can increase your lifespan. But
Right.
just because your lifespan is increased doesn't mean that you will be fully functional.
You'll be at your best health.
Yeah, you'll have your energy, you'll have everything. Doesn't mean that. You'll just live longer. Anti-aging medicine, on the other hand,
Right.
aims to increase your health span, right? So that you live more years without diseases. It actually can prevent and sometimes even reverse diseases which are to come about.
Okay.
Yes.
Okay. So, I've always believed that practice what you preach, and I believe you practice what you preach, right?
Well, practically.
Yes. So, it takes me back to the first time I met you. I don't know if you'll remember this. And I made a new friend in you, but I also made I would not say an enemy, but somebody who was not so fond of me after that. So, this doctor who was a radiologist, she and I were working together in the
Right.
first lab, and we came to meet you to talk about that, we now have pathology and radiology services. And this doctor herself, extremely good looking. She was a Lux model at that time or before that. And we came and met you. And the moment we came out of the clinic,
That was almost 30 years ago, right?
it was 1995, 30 years ago.
Okay.
Yeah. And I came out of the clinic and I told her, my God, Dr. Sunita is so good looking. Now, when you praise one woman in front of the other, somebody is not going to be happy,
Oh my
right?
God, I never knew that.
Yeah. So that was my first interaction with you, more than 30 years ago. So I made a new friend in you, but I think, displeased the other person who was with me at that time.
Oh, okay. That's sad.
No, but I'm like, the good thing is that I can see that in 30 years, you look just the same. You look just as radiant, just as glowing. I think age has not been a number for you. But, for me, for example, right, when I'm with my wife, Anju, and she looks younger than me. And especially because I have no hair, right? So it's obvious that, people think I'm significantly older. Now, I wanted to ask you, is that been the trigger for people to seek anti-aging just by their looks? When people say, oh, are you 60, but you look more than that. You don't look 60, you look 65 or you look something else. Is that the real trigger for people to come and see you when appearance, sort of does not match with their actual age?
So, all of us want to look good, right? I have my 4-year-old grandson who knows what to wear, who decides what he wants to wear. And I have my friend's 90-year-old grandmother,
Right.
who just about has 4 hair on her head, but yes, she wants to blow dry it because she wants to look good.
Right.
In fact, all of us want to look good. And if you find people that they say, no, we're not at all interested in appearance, you've got to look and see whether they're actually depressed. I have to look around and see whether they're depressed. They don't want to do anything with their looks. I'm not saying just focus on your looks. And the whole thing here is, I want to tell you is that I want to talk to you today about focusing on your insides, right? The looks, as I call it, is just the icing on the cake. The main cake is your inside. Right? And so therefore, if you have both of them, why not? You
Sure.
have a fabulous package, right? So
Perfect. So let's add this, that's a good segue to say, how do we unpack aging itself? What's actually happening in our bodies as we age? And why do some people age differently from others? There's some role of genetics, and I've been told genetics plays maybe just 20% of the role, but lifestyle plays a significant, part of that. So why do some people age differently? Some people living in the same household, one looks much older than the other. Let's just demystify aging, and what's been your experience of how people age? Why do people age differently, and what's been your experience in that?
okay, so you've asked me 5 questions in all that.
Oh, okay.
You have.
Sorry,
So we begin-
let's break it down.
Yes, okay.
Let's demystify aging. What is this whole process of aging, and why do people age differently?
Right. Okay. So all of us age, right? There's a gradual decline in our cells, in our tissues, in our organs as we age. But as I said before, how we age is up to us. I'll talk to you about what are the things we can do to prevent or delay our biological aging.
Okay.
Chronological age is how old you are, right? That's
Right.
your chronological age,
Right.
right? And biological age is how your body acts, how you look. So through lab tests, etc., how your body acts is what your biological age is.
Okay.
So anti-aging medicine, firstly, let me explain to you, hopes to prolong, extend, lengthen this your biological aging. Okay?
So meaning if you are, suppose I'm 60,
Right.
if I am practicing anti-aging, it means
Right.
my biological age would be less than my chronological age.
Yes.
Would that be the correct way
Yes.
to interpret that?
Absolutely.
That if I'm 60 chronologically,
Absolutely.
but
You look
biologically
younger.
I'm 55, that means I'm doing the right thing.
Yeah, absolutely.
That's what it means basically.
Yes.
Perfect.
Yes, it means
Okay.
that.
Okay, great. And why do people age differently?
Okay,
And what's been your experience
so there
there?
are many factors that play a role in this: genetics, right, and lifestyle. Those are the two main things.
Right.
Genetics plays. We used to think that genetics and lifestyle is 50-50. 50% genetics, what you're born with,
Right.
and 50% how you live your life, your lifestyle. But now we know, and with more and more research, that genetics only plays a 20 to 30% role. The rest, 70 to 80%, is to do with your lifestyle.
Okay.
Now, so that's very encouraging, because you don't have to say, okay, I've got bad luck, I'm just born with bad genes. But you have hope that because if you improve your lifestyle, you can even become a super ager. These super agers are people who live to their 80s and 90s.
Right.
But bodily and biologically, their age is only about 50.
Okay.
Yeah. So one has it within them to be able to modify your life, to be able to increase your health span in this way.
What's the biggest difference you have seen in anybody that you have worked with?
Right.
That chronologically they were at this age, but biologically, so what's been the maximum difference that you have seen? Somebody who was 70 chronologically, but biologically they were, like you say, 50. What's been your experience there? I mean, what's the common expectation people may have to say that, even at 75, I can still feel 55?
Right.
Would it be 5 years, 10
Right.
years difference between chronological age and biological
So I've
age?
definitely seen 5. See, we don't have the biomarkers, so many biomarkers. There are lots of biomarkers to calculate your age, like you have epigenetic clocks, etc. So we don't have that at our disposal.
Right.
But broadly, about 5 years, and I've even seen maybe 10 years.
10 years.
Right?
Okay.
Now, Brian Johnson, who's conducting the largest
Correct.
experiment in the world,
Yeah.
he just hopes to be 5 years younger.
Okay.
That's it.
That's his target.
Biologically, that's his target.
Okay. So that's
For
a good
which-
target for all of us, that
Yes.
whatever we are chronologically,
Yes.
if our biological age is at least 5 years less than that, we are doing the right things.
It can be more than 5 years.
Yeah, but at least 5.
Yeah. So genetics is like, if I were to give you an example, is like the car that you've been given. And lifestyle is either your brake or your accelerator.
Okay.
Okay, so that depends on it depends on what fuel you're going to put in, the quality of fuel you're going to put in, how you're going to look after it, how you're going to run it, etc. So these are the two main things.
Okay.
Now, obviously in lifestyle, there are many other factors that come into play. For example, the environment you live in. How many toxins are you exposed to? Today we live in a world where the air, water, and food is all polluted, right? And therefore our body is subjected to so many oxidants. And the body can only make a certain amount of antioxidants, to protect us.
Sure.
But when the load is so much on the body starts breaking down. The cells start breaking down.
Okay.
Actually, aging, if you look at every cell and you give every cell the proper amount of nutrition, you give it the proper amount of hormones, and you detoxify it, the cell doesn't break down.
Okay.
Right? So then aging can be prolonged.
Prolonged, yeah.
Right? I mean, anti-aging can be.
Right.
So, yeah.
So the process of aging can be delayed.
Yeah, the process of aging can be delayed. Okay,
Right.
so apart from this, so the environment plays a very important role. Our hormones play a very important role, because after a certain age, we lose our hormones. Right? After the age of 40, the hormones start declining, but yet we are living longer. So anti-aging medicine, as I say, without your hormones, you're going to suffer. You have so many changes, mood changes, anxiety, hair loss, you get a pot belly, and so many other factors come in
Sure.
at that time. So I say that as I tell my patients, I want you to go into your old age in a Ferrari, not in a bullock cart,
Right.
okay, with aches and pains and all. And that's up to you.
Right.
Okay, so when things start declining, like your hormones start declining, then we can replace the hormones. Your
So lifestyle, hormones, what is the
Yeah.
other category?
Yeah.
What else?
Stress is another
Okay,
very important.
So talk about inflammation if you can.
Yeah.
That's important.
Okay, so stress is another very important factor, which causes us to age much faster.
Okay.
Then chronic inflammation, which occurs as we age.
Right.
That's an important factor. So in lifestyle, we have things like diet, which is very important, and I'll talk to you a little more about
Yeah,
the
so
diet.
before we get into that, so are there measures for stress? Are there measures for the toxins that you breathe? Are there measures for inflammation? So do you get some sort of a baseline measure done before you sort of put any intervention to people?
So we don't have all those tools at our disposal now. That is where we need more of this for our future.
So like cortisol is a surrogate marker
Yes.
for stress.
Right.
Do you still, is that?
So that's exactly what I was going to tell you. So basically, by doing our hormones, we do know that if your cortisol goes up, it's your stress hormone.
Okay.
So that's putting stress on your body. It's increasing your sugar levels. It may cause diabetes, etc.
Sure.
So these markers we do have, but we don't have any specific anti-aging. As I said, we have epigenetic clocks and all, like the Horvath clock, etc. But we don't have it with us as yet.
So you use the commonly available tests to decide
Right.
whether it's hormone levels.
How much inflammation is there? So many markers tell us about inflammation in the body. So we get to know that you have inflammation, you have stress, you have low iron, for example.
Sure.
All that tests tell us whether you have high cholesterol, whether this is what you're going to be getting. So you get your little indications from that.
You mentioned about super agers, right?
Right,
And
right.
these are people who live maybe up to 100.
Yes.
And I know that there are places on the planet called blue zones.
Yes.
I know some places in Italy, some places in Greece, some places in Japan.
Yeah.
That are known to have people who live up to the 90s and the 100s, right?
Right.
What's their secret, and has understanding their lifestyle helped us, devise better plans for anti-aging?
Okay, so as you mentioned, there are 5 blue zone areas in the world.
Okay.
One is in Okinawa, Japan, Icaria in Greece, Sardinia in Italy.
Right.
Then you have a Nicoya Peninsula in Costa Rica.
Okay.
And
yeah.
you have a Loma Linda in California.
Right.
These are the areas where people live beyond 80, 90, and even beyond 100.
Right.
So this has given us a lot of inspiration and has taught us a lot about how we can live to be older, right? To be how we could be.
Understand from their
Yeah.
lifestyle
How-
and then create some sort of
Yeah.
protocols.
Correct. So this has taught us how we can follow them
Right.
and live a much healthier life
Right.
and longer life. So the thing is, with them, there are many things that they follow. First is their food habits,
Okay.
which is very important. So they eat mainly whole foods. They eat plant-based foods.
Okay.
They eat very little. They hardly have any meat at all. Very little eggs also.
Okay.
They have fish occasionally,
Okay.
right? And they may drink only goat's milk sometimes.
Okay.
So these are the things that they do. But their main focus is on vegetables, fresh vegetables, fruit, lentils, legumes are their mainstay, and they don't eat any processed food. So this is where their health is concerned. Yes, they do drink a little wine, but that's only on occasions.
Okay.
Right? Smoking, of course, is not there at all.
Okay.
So this is as far as that is concerned. Then their habits where exercise is concerned. They
Right.
don't go to gyms, etc.
Okay.
But they do a lot of movement. They climb stairs, they do gardening, they walk. So these are all natural movements they follow.
Okay.
Today the whole trend is go to a gym, exercise.
Right.
And what I'm finding in my patients is that once they start over-exercising. And that over-exercising is actually harmful for them. It doesn't act like an antioxidant, it
You're
acts like
saying
an oxidant.
so movement over exercise.
Yes.
Natural
Yes.
movement
Yes.
seems to have a more beneficial effect
Yes.
than just structured exercise in the gym.
Absolutely. So
Okay.
these people do that.
Okay.
So they have natural movements,
Right,
right?
right.
Another very important part of their culture is socialization, right?
Okay.
Something which we all, we don't so much have much of in living in big cities, right? So they socialize, they meet at their churches, they, so that way they keep in touch with each other, and
So social connect.
the social connect is a very important human connect. If you were to ask me, I'd put it quite up there in our
Right.
anti-aging. If you ask
So
me, how do you anti-age?
so
Yes,
instead of Facebook, it's face to face.
yes, face to face.
Right. Okay.
Okay, so that's what we're missing, and I think that's their secret.
Okay.
Frankly, if you ask me, that's one of their biggest secrets.
So simple diet, movement, social connectedness.
Then they don't have their mindset. Their mindset is a very simple mindset. They don't stress about things. Okay, they just let things be and accept things. What will be. Okay, and they have what the Japanese believe in, ikagai.
Right.
Yeah, that you wake up with a purpose every morning.
Okay.
So they have a purpose. They believe in that. Also, one more thing, which now that I'm mentioning the Japanese thing, about their food habits, right? So they eat only till they're 80% full.
Okay.
The hara hachibu, which the Japanese call. You get off the table when you're 80% full.
Is there a practical way to know that? Everybody will want to know that what is 80%. There's no sort of a fuel gauge that tells you, 80% stop eating.
Okay,
how do you do that? You seem to be practicing it well. How
Okay,
do you
so-
do that?
No. So first of all, eat slowly.
Okay.
Then your satiety hormone, okay, which is leptin, kicks in.
Okay.
If you eat too fast, then leptin doesn't kick in and you'll keep eating,
Okay.
right?
Eat slowly.
Yeah,
Okay.
so you've got to eat slowly, you've got to chew.
Right.
You've got to chew your food as much as possible.
As you said, use all 32 teeth.
Yeah, please use all your teeth to chew your food so that the enzymes can work on it, and
Sure.
and it can be digested, and it's easier for the body.
Right.
The other thing about them is that they know how to beat stress by meditating, by prayer, etc. We all know meditation is such an important part. In fact, I gave a lecture in Bangkok called Meditation, an Essential Medication. Yeah, it's
Meditation
that
and
essential.
essential medication.
Yes,
Very
because there are
nice.
so many hormones.
So would that be the same thing as mindfulness? Is that
Yeah,
the same
mindfulness is a type of meditation.
type of meditation? Okay.
So
So you're
that-
saying you control the stress
Yeah.
through mindfulness or through meditation?
Yes,
By keeping your mind calm.
Yes, so your cortisol hormone is not released,
Okay,
right? And
okay.
so that's how you
Interesting.
do it.
Okay.
So these people live lives like this.
Very
And
nice.
therefore, so if we were all to follow it,
Right.
have a diet like you don't have to be vegan, right?
Right.
Now all the vegan people are going to get very upset with this.
No, but
because
that's
they're
okay,
such
I think-
hardcore followers of veganism is like a cult, and if you say anything to them, no, they won't. But what I'm trying to say is that this is exactly what I'm saying. Don't be so obsessed with anything. Don't say, no, not this, not that. The amount of stress that causes, and the amount of,
Anxiety.
harmful substances that are released in the body just by being so strict with yourself. Allow yourself a little. You've got to live too.
Sure. So I like this concept of movement versus exercise.
Yes.
But what I'm trying to pick up is on the diet, that processed versus non-processed food, I
Yes.
think, or ultra-processed food, which has now become very common, versus using naturally cooked food or plant-based food. I think that probably makes a big difference. And the other, like you said, is social connectedness, keeping yourself happy, keeping your mind calm,
Yes.
staying in the company of friends. I
Yes.
think all these things probably play a
Yes,
very
we
big
all
role.
need support. Human beings need support.
Right. And you put all this into sort of customized plans for your patients?
Yes. So I take a long time explaining. I take longer. I do longer consultations with them.
Right.
And I try and inculcate everything and put in everything into them so that they
Okay.
start changing their lives. Because even one lifestyle change makes such a difference.
Oh, so you don't have to do all of it.
You begin with one.
One, okay.
I'm happy when they begin with one.
One.
And when they don't begin with anything and
What's
they come.
the easiest you've seen people, being able to follow? Is that diet? Is it exercise or movement? I hope it's not the drinking wine every evening.
No, it's definitely not. Okay, there was one more thing which when we were talking about the blue zone people.
Right.
Is sleep.
Okay.
Right.
Yes, of course.
Now, sleep is very, very important.
I
okay?
completely agree with you on that.
Yeah, so the blue zoners sleep early in the evening at about when the sun sets.
Okay.
And they get up early in the morning.
Okay.
Okay, this is very important because when we sleep, there are 2 hormones that are released. One is melatonin and one is growth hormone.
Right.
And both these are our repair hormones. So
Okay.
if you sleep, say, at 9 o'clock at night, okay, difficult in this city,
Very
difficult. Okay, but don't make it 3 and 4 and 2 and stuff like that. Even if
Right.
you can pull back every day a little bit, you know.
Right.
So this is how I tell my patient, just keep pulling back a little bit.
What time do you manage to sleep with your such a busy lifestyle and
Yeah.
so many patients calling you throughout the day and night?
Yes. So I sleep at about 10 o'clock. I try aim to.
Okay.
Okay. And because, as I said, these hormones get maximum hormones at about 2 and 3 at night.
Okay.
So you want the body to repair. Imagine if the body is not, the body is like a machine. If it's not repairing, it's going on to the next day with break, wear and tear.
Correct. So I've seen this somewhere that the best way to sleep or the best way to repair yourself is to, normally you charge your phone, but you need to, discharge yourself. You
Yes.
need to disconnect yourself
Yes.
from everything. So you
Yes.
disconnect to recharge your mind and body.
Yes, absolutely.
Right. What's the role of supplements in your experience? Like I know when you mentioned sleep, right? Some people say take magnesium to fall asleep. Magnesium in terms of tablets, or magnesium in terms of creams. What's been your experience on supplements overall? So, and you mentioned diet, so people take omega-3 fatty acids. Some people take berberine, for glucose control. So just maybe your thoughts on supplements.
Okay, so I'm a big supplement user.
Okay.
Because what I want to explain this to you. When in the olden days, the river used to come flowing down, it used to bring new silt with it, new mud with it, full of minerals.
Okay.
And we used to grow our vegetables on it, and then we used to consume it. So we got our supplements, right?
Okay.
But now man has put a dam there. He's actually damned himself.
Damn it.
He's damned himself. So as a result, the vegetable and fruit is grown on the same soil and we eat the same thing. Again, it's grown on the same soil. Again, we're eating the same thing. So we have no minerals. So
Right.
to all the people and all the doctors who say, no, vitamins are not necessary, they just get peed out, etc., I do not believe that because
Okay.
this has been my experience. That's how I
Okay.
started off, by giving a few supplements and seeing the change in people.
Sure.
Okay, so I'm a big believer, but you don't overdo it. Now, magnesium, as you mentioned, is my hot favorite.
Oh, it is. Okay.
It is. And magnesium takes part in almost 300 enzymatic reactions in the body. We know that.
Okay.
Okay, so it's so important.
Okay.
And when I give it to my patients, their bowels move better. There are different forms of magnesium, like this magnesium glycinate, threonate, oxide,
Right.
So you have to decide which one you want to use. Like, for example, glycinate. It improves your sleep. My patients go off to sleep. In this city, most people suffer from sleep disorders, right? You'd agree with it,
In
right?
this world, I think,
In the
today
world, right.
we are
In the
so
world.
we are so digitally
The
connected.
world today is in a mess. Okay,
Yeah.
so sleep, it definitely affects your sleep, whether you want it or not.
Right.
Right? Because the whole thing comes back to you at night.
Right.
So magnesium puts you to sleep.
Okay.
Now, what better way of going to sleep instead of taking a sleeping tablet, right? So therefore, supplements play a.
So magnesium is okay according to you.
It's a must.
It's a must.
If you're not taking it now, I better prescribe
No,
it for
I
you
am
right
taking
now.
it. That's why I wanted to ask
Thank
you.
Yes, you must.
Because my family keeps questioning me, why are you taking magnesium?
Yeah.
I tell them because I sleep better. I actually sleep better.
Yeah, see?
Yeah.
You sleep better.
Yeah.
So you know it. The proof of
Yes.
the pudding is in the eating.
No, I thought, but getting it from the expert's mouth would be the right way.
Definitely. Magnesium is. I've been writing magnesium when no one ever wrote
So
magnesium.
let us know for the audience, what are the supplements that everybody should include, which are the easy ones,
Okay.
The magnesium being one, but the others, what do you think?
Yes. So vitamin D is very important. It's
Okay.
the most important vitamin hormone.
Okay.
Right? When people died of COVID, they found that those who died had no vitamin D in their bodies. Okay? So you can imagine the role that vitamin D plays in every area.
Immunity in particular, right?
Immunity, our brain health, our cardiac health, bone health, of course, we already know.
Yes, yeah.
So therefore, vitamin D is a very important hormone. So everybody should be on a vitamin D hormone. Now, how many of us actually go out in the sun? We don't, right? We go from home to our offices and that's it. And then the sun is gone by the
Right.
time we emerge from our offices. So we need supplementation with vitamin D. There is no such thing as over supplementation. So
Okay.
this is all the people have these myths in their heads,
Sure.
which is not true.
And
okay?
what is the form of vitamin D that you recommend? Is it the one tablet once a month, or is it something that people should take every day?
So I recommend a daily tablet of
Okay.
5,000 international units per day.
Okay.
Okay. And I've seen best results with it.
Okay.
And in America, they take 10,000 units per day. Okay.
But
And
they're
you-
bigger built also, I
Yeah.
guess.
In Europe, they mainly stick to 5,000.
Okay.
So 5,000 is safe. Yeah. So in India, we don't get the 5,000. So you can use the 60,000 once a week.
No, but it's available. I'll give you the name.
Is
the
it?
5,000. I take that.
Which one?
I'll tell you. So Vrinda gets it for me.
I've been
give you the-
waiting for it.
I'll give you the name.
I've been waiting for you to write it from. You get 2,000, you get 4,000, but you
5,000.
don't get the 5,000. Okay.
I'll show you.
Great.
I'll give it.
Great. I'll be happy to
Yeah.
learn that from you.
Yeah,
Okay.
yeah.
Okay. So then vitamin D,
Yeah.
then vitamin B12.
Okay.
You know, if you balance your vitamin D and B12, more than 30% of your health is balanced. It's so simple.
Right.
And the third thing I'd include is to balance your insulin levels.
Okay.
Okay? So you got to eat smart for that.
Correct.
Okay? And right for that. And avoid sugars, carbs, etc.
What does that mean to a common person? Eat smart and eat right. Just break it down and make it very simple.
Okay, so your food should not have too many carbohydrates in it. Today we
Okay.
know that,
Okay.
right? You know that we were sold an idea that carbohydrates were good and fat was bad in the 80s,
Right.
right? And that's why the whole world became fat. But today we know that fat is a better form of giving us energy than carbohydrates is.
Right.
So we've got to shift our food from carbohydrate burning to fat burning,
Right.
which is like the keto diet, right?
Sure.
So a kind of a keto diet is very healthy, right? As long
And
as you eat the healthy fats.
And you plan a diet for your
Yes,
patients?
I plan a diet for my patients.
And I know your daughter also specializes in making
Yes.
customized diets for some of your patients, right?
Yes, she uses food as medicine.
Okay.
Okay, she wants to get as
Okay.
natural as that.
So that's
of course.
that's going to be part 2 of our conversation where we get Alika to come and speak on that.
Okay.
Yeah.
All right. Okay. So
So we're talking about how to make the diet, something which people can easily follow. So one is reduce the carbohydrate content. What else?
okay. So let me begin before that.
Okay.
I'm a firm believer in intermittent fasting.
Okay.
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 So I believe that you can begin with 12 hours,
Right.
then you can make it 14 hours,
Right.
16 hours. If you could go up to 18 hours, fine.
Okay.
The things that it does for your body
But
are
how often
amazing.
should this be done?
You can do it thrice a week, 4 times a week. You can do it daily,
Okay.
right? And so there's a lot of research on this.
But
And
you recommend your patients to go on intermittent
I do.
fasting at least for 12 to 14 hours a day?
I do, even if they're diabetic. Of course, I
Yeah.
go a little slow with them.
And
Because I do believe the
and if
diabetes
somebody is
can be
doing
reversed.
somebody who's watching us says, okay, I can do it only 3 times a week. That's good
That's
enough.
fine.
That's fine.
That's exactly what I'm here to tell you. That
Okay.
even one small little step
Right.
towards it goes a long way.
And what is the kind of
improving your health.
intermittent fasting that you recommend? That you skip breakfast? Is that the easiest way to do
So that's the
intermittent
easiest
fasting?
because you sleep at night. So
Right.
if, say for example, you eat your dinner and you finish your dinner by 8 o'clock.
Okay.
Right? The next day 8 is 12 hours.
Right.
So 12 o'clock is 16 hours.
Right.
So you can eat your first meal at 16 hours. After 16
And
hours.
in between these 16 hours, what can you have other than water?
So you can have plain black tea or plain black coffee.
Okay.
Yeah, that's allowed.
Okay.
And
just,
water.
And in India, I'm saying, would a plain chas be okay?
No.
No. Like this just curd and
No.
water? No?
No.
No. Okay. Take it. Because I try and practice intermittent fasting, but I have 1 glass of chas in the middle.
No.
Won't-
Then it's
no.
not
That's
intermittent fasting.
What about coconut
So
water?
No.
No. Okay. Only black tea or black coffee
Only black tea or black coffee.
or water.
Yes, or
Okay,
water.
okay.
Because the idea is that the body starts thinking that it's got no food.
Right.
Right? So all the waste products which are accumulating in the body as a result of metabolism, it uses that to provide it energy.
Okay.
Right? It's called autophagy. Using up the cells, right? The broken down
Okay,
proteins,
okay.
etc. to provide you energy.
Right.
Right? So then your body gets detoxified, gets clean. So that's my first thing. which I advocate. There are a lot of people now talking against it, but I don't
It's
believe
seen it work for you and for your patients.
I've seen it work in every single patient of mine.
So let me just, stop you there. And, I have always been intrigued with this concept of fasting that we have in India, right?
Right.
So some people fast on Mondays, some people fast on Tuesdays, and they associate with some god, some deity.
Right.
As long as they do it, it's good enough, right? I mean, no matter what the reason it is, as long as they do it. I feel fasting actually has a scientific base. Religion is only used to implement it.
Of course, you're right. You're absolutely right.
Yeah.
Because I watch it in my maid who fasts so many times a day. And I have
Right.
to tell you, she's a young maid. She's not so old. She's only 45. Now, for me, everything is young, okay, by the way. So I've learned this from my maid. Genetically, all her brothers and sisters suffer from stroke and high blood pressure and diabetes. And her younger sister has just recently had a stroke. But she is okay. And
Because she
though her
fasts.
blood pressure is slightly high, her sugar is slightly, but she fasts 3 days a week. And I say that's what's keeping her going. So, you learn from patients, right? And I've learned
So all
from
those
that.
people who do fasting on Ekadashi, keep it up.
Yeah, please. Well, the Christians have it, the Muslims have it.
Correct.
All those
All
fasting.
religions.
But
Nowadays we have, Jains who fast in Padyushan.
Yes.
Yeah.
Well, my daughter's done 8 days fasting without anything.
Perfect. Okay.
Yeah, so that's all good. And I asked her, what did you feel? She said, it just cleansed my soul. So obviously, it is tied up to a lot of other feelings.
Biology is the root cause.
Yes.
Religion is just the way to implement it.
Yes. So
Perfect.
it doesn't matter. Use religion.
Okay.
But use it.
Good. Okay, so fasting is one. What else would you recommend?
So then when you begin your first meal in a day, make it a high protein diet. At
Okay.
least 25 to 30 grams of proteins.
Okay.
Right?
What does that mean for a common man? 25 grams of proteins.
So I'm
a vegetarian, so I don't eat non-veg.
You don't eat eggs either?
No, I'm not saying me. I'm just saying
No, I know.
common person.
The person.
So eggs is one source of protein. How many eggs would make it 25-30 grams?
Okay, so each egg only has about 8 to 9 grams of protein.
Okay,
right?
so 3 eggs.
You wouldn't need that much.
3 whole eggs.
Right. Well, you can take out the yolk from one. You can
Okay.
use 2 yolks.
Okay.
And you can, because it's the egg
And
white
if I
that
don't eat
contains
eggs,
more.
for so many
So
Indians
that's
who
what
are
becomes
vegetarians.
difficult. That's what becomes
So I know
difficult.
paneer and tofu are supposed to be.
Yes, of course, paneer and tofu, but you can't have paneer and tofu in each meal.
Okay.
Right? You'd have your paneer and tofu at your dinner.
Right.
Dinner time is a good time to have your paneer.
Okay.
Though the first thing I do for most of my patients is I take them off 3 things completely.
Okay.
One is dairy,
Okay.
because dairy, the milk protein, the casein and the lactose are very inflammatory for us. Okay?
Oh.
The cow's milk should be for the cow's baby, for the calf. It's not for us. All right?
Wow,
I lecture
okay.
on this.
Okay.
Milk is so contaminated today. It's full of antibiotics and full of estrogen. Why? Because the cows are pumped with estrogen so that they can give more milk.
Sure.
They're constantly being pumped.
Okay.
So that is why girls today, you see a lot of girls with PCOS.
Correct.
Yeah? That's because their estrogen levels are so high, progesterone is low.
Oh, that's
one
because of
the
drinking so much
reasons.
milk.
Yeah, because of drinking so much milk.
So what is a good milk substitute?
So what does milk really give us? It gives us a lot of calcium, right?
It gives
So-
us, my mother told me to drink milk. That's what it tells us, basically.
Exactly.
It's good for your teeth and your bones. That's what we've been told.
Well, in those days it wasn't so bad when you were growing up,
Okay.
right? Because it didn't have so many hormones and it didn't have so many antibiotics. Okay,
Right.
these are all things which have been added
Okay.
after that. So that's the first thing I ask you to stop.
Okay.
My patients to stop. The next thing I ask them to stop is wheat.
Oh, so
Yes.
chapati.
Yeah, chapati. Now,
Oh my God.
yeah, but you can eat other forms. I'll just explain that to
Okay.
you. Why wheat? Because wheat used to have, the structure of wheat used to have 6 chromosomes. Now it has 23 chromosomes. And why is that? It's been
Biologically
tampered with.
modified.
Yes, it's been genetically modified. And why? So that it can grow faster and give you profit faster.
Okay.
So man has done that, and wheat all over the world.
Okay.
So this is highly inflammatory for us.
So milk, wheat, 2 common staple diets that we all grew up on.
Right.
You are saying no to that.
And
And
I'm
what's the
saying no.
third?
And the third is sugar.
Oops.
Yes.
So meaning no jalebi and gulab jamun. So even in your tea and the coffee that I'm drinking, no
Yes,
sugar in
no
this.
sugar.
What is the sugar alternate?
I'm sorry. You do have sugar alternatives like monk fruit sugar and stevia, etc., but they're not
Okay.
so good either. Anything processed is not good, so even that's also there.
So what about jaggery?
Jaggery is also sugar, honey is also sugar, before you
Okay.
ask me the next question.
Okay.
Okay? That's all sugar.
So if somebody wants to have sugar, then what should they do?
So once in a while they can resort to monk fruit sugar or stevia, right?
Okay.
Or they can have a little sugar once in a while.
Okay.
Okay, but very little. Less than 3 teaspoons
So no
in a
milk,
day.
no sugar, no wheat.
No.
Okay. Now what should they eat then? As they say,
There is
why should I
some-
live? And here we try to increase lifespan and health span.
Oh my God. So I don't want the stress to come on, okay? Because that will negate the whole thing.
So what's the diet then for that?
Okay, so you have so many things to eat. So my patients
So
who
wheat,
eat-
so substitutes for wheat you were going to tell me.
So jawar, bajra, ragi,
Okay. So all the billets.
rice, millets are fabulous.
Millets are fabulous.
Yes.
So millets equals to great.
Yes.
Okay, perfect.
Okay. So that's what you can substitute.
Okay.
And sugar, of course, you'd use monk fruit sugar and
Okay.
stevia.
Avoid as much as possible.
Yeah, even that avoid.
Dark chocolates?
Dark chocolates, they're very full of antioxidants.
Oh, you can eat that.
Not too much.
Okay.
Don't
Okay.
overdo it.
Okay.
A little bit, yes. As
Okay.
I said, we have to live too.
Yes.
Right?
Right,
I'm
okay.
not taking that away.
Okay.
Because if you stop yourself, you'll get so stressed. If you
Correct.
get so stressed,
Yeah,
your
you'll-
cortisol go up. Cortisol goes up, your inflammation goes up. Inflammation goes up, chronic disease.
So you say
is
no
coming.
milk, but is yogurt okay?
No, that's also made from milk.
Okay.
But you do need probiotics. Today, the amount of research that's been done on the gut microbiome, which is such an important part. You know, as Hippocrates said, 300 BC, he said that we are what we eat. Okay, and it's so true. He said it then.
Right.
All right. So that's why I tell my patients, look at your food, what you're going to put into your mouth. Just look at it for 2 minutes. If you think it's good for you, put it in. If not, please chuck it out.
Wow, that's so simple.
Yeah, it's simple. I believe in getting back to basics, okay? So this my whole trend now is to get
So
back
these super
to
ages
basics.
don't have desserts.
No, they don't.
Oh, okay. We'll have to figure out what do they do for dessert. I guess they're not from Punjab, right? All Punjabis have desserts.
True. It's an
There are no super ages in Punjab.
genetic. Yeah.
Okay,
No
okay.
super ages in Punjab.
Okay, no, that's great. I think so. Millets, avoid milk.
No, but I want to go back.
Please.
Punjabis have a gene for longevity.
Really?
Really. They do have a gene. And therefore, that sugar now is making them, but originally, they lived for much longer.
Yeah, because they have those Patiala pegs. Got nothing to do with alcohol, right? I mean, because you said a little bit of wine is okay.
No, I said a little bit of alcohol in moderation sometimes is okay. No smoking.
No smoking.
Okay?
So what's been your experience with hormone replacement?
So-
And you said that as you age, your hormones go down.
Decline.
Now, isn't that natural? Do you think the body actually needs replacement of hormones?
So, okay, let's look at it. What happens to a woman when her hormones start declining, right? A woman has two main hormones, estrogen and progesterone.
Right.
Progesterone starts declining right in her 30s, okay? And estrogen declines later in her 40s and then goes on to decline. Now, these are the sex hormones, but they're not only sex hormones, they're metabolic hormones.
Right.
Estrogen plays a very important role in our cardiovascular health. It plays a very important role in our bone
Bone health,
metabolism.
right, right.
So imagine if these go down, right? Progesterone plays a very important, I call it the happy hormone. When it starts going down, women start getting anxious and, they suffer from mood changes,
Sure.
and sleep disturbances and all this. So all this starts happening when this goes down. So imagine you're living longer and you don't have these hormones, right? So obviously you want a better quality of life.
Quality of life.
So you can
Right.
substitute it.
Okay.
Right? Similarly in men, they have testosterone, which
Right.
also goes down
Correct.
much later than, they're luckier
Right.
as in all aspects. Right? So their testosterone takes longer to decline.
Okay.
But it does decline also. And so testosterone is a metabolic hormone too.
So how do you supplement hormones? So do you first take a measurement and
Yes.
decide based on the levels,
Yes.
and then decide how much to supplement?
Yes. Take a base level.
Okay.
See it's low. Correlate it with the symptoms. right? If they're really suffering.
So how do you ensure that the hormones that you give are safe? I mean, is there a particular type of hormone that you give, like you said, bioidentical hormone? What
Yes.
does that mean?
So bioidentical hormones are hormones which are not synthetic.
Okay.
They are made mainly from yam and soya.
Okay, so plant-based.
They're plant-based, and so they're more natural.
Okay.
Definitely more natural.
That's why called bioidentical.
Yeah, so it's bioidentical.
So when you say bioidentical, does it mean identical to the biological hormones that we have?
Yes.
Okay.
Yes.
Okay.
Versus the synthetic hormones, which are not bioidentical.
Okay.
Right? So these are safer because synthetic hormones we know can cause cancer.
Right.
Right? And they have a lot of other side effects too.
Okay.
Clotting of blood, etc. But these bioidentical are much safer and don't have these side effects.
Okay.
And why we need them, as I explained to you, they decline. So we need to substitute. We're living longer.
Right.
Right? But I always combine it with the symptoms. I don't push everybody for it because, as I said, genetically, some people are born with genes which are so protective,
Sure.
and they may not need it.
Okay.
So if they don't need it, I don't need to give it to them.
Okay.
But when they want it and they're really suffering, I definitely want to substitute, but with bioidentical hormone replacement.
So it's for your mood, it's for your metabolism.
Mood, it's metabolism. It's for
Functional
it's to
health.
decrease anxiety. It improve your organ function.
Okay.
Your gut micro. So many factors.
And does it come in form of tablets or comes from creams?
It comes as gels.
Gels, okay.
Yes, and it also comes in as capsules.
Capsules, okay.
Or troches, which you can put under your tongue.
Okay.
Yeah.
Some examples of how people can access red light and what does it do to them? I mean, maybe your experience with using red light?
So red light is the visible red light that we can see.
Right.
Right? And far infrared is the one that is beyond that.
Invisible, yeah.
Invisible. And far infrared is very good for detoxification of the body.
Okay.
Okay? In maintaining mitochondrial health, in
Okay.
preventing inflammation. So it works at various levels.
So it's like a sauna.
Red light, the
it's
red
like
light works on the skin,
Right.
mainly on the skin and the superficial areas.
Okay.
Whereas the far infrared works on your circulation, on your mitochondria, etc.
How often should
and
somebody take this
detoxifies.
far infrared?
Yeah, thrice a week you can take it.
Is it like a sauna kind of a treatment?
Yes, it is. It is, but
And is it easily available?
you have to go into a far infrared machine.
Okay. And is it available in India, in
Yes,
Mumbai?
yes. For many years it's been
it's there?
available. Yes.
Okay.
It's a very good method of detoxifying the body.
I'm jumping to the pharmacological interventions on anti-aging,
Right.
and the two drugs that I've read about, rapamycin and metformin. What's been your experience with these two drugs?
So metformin as an anti-aging drug has been studied for many years now, and currently there are 3 important trials, including the TAME trial, which is assessing metformin as an anti-aging drug. We are not yet clear about it, but soon we should be clear about that. But my personal thing is that apart from diabetics, I like metformin for older patients.
Okay.
Right? Now, since it already is, and there's a lot of evidence now in favor of it being an anti-aging drug.
Okay.
And as we age, as I said, insulin is the thing that goes up, hormone that goes up. So our blood sugar naturally rises as
Correct.
we grow. So I like to give metformin to my older patients. Of course, I can give them berberine, which is a natural supplement,
Right.
and which definitely brings down sugar. And trials show that metformin is as potent as berberine. Berberine and metformin are equally potent.
Equally potent,
Yes.
okay.
So, but
And berberine is a natural
is a natural supplement.
Okay.
But sometimes when I don't find good results with that, I like to give metformin.
Okay.
And I'll be very happy if it is 100% proven as an anti-aging.
Okay.
But only in my older patients. So I choose my patients well
Right,
for that.
right.
As far as rapamycin is concerned, I mean, rapamycin has made headlines for the last 5 years. Okay? Every researcher has only said that rapamycin is the drug of choice for anti-aging. It is the only truly proven anti-aging drug.
Okay.
Right? Now, Brian Johnson has been taking rapamycin for 5 years now. Right? But recently he has stopped it, because of the certain side effects. I know it has few side effects like aphthous ulcers, etc. But his sugar went up and a whole lot of other problems occurred, so he had to stop rapamycin.
Okay.
So that's the current thing on rapamycin.
Okay. So the research is still out there.
Yeah. Yeah. So for how many years can we safely use it? That's why I say anti-aging medicine requires many more years of trials
Sure.
with these supplements.
So this, semaglutide seems to be a wonder drug that can do everything.
Yes.
Has that shown any anti-aging effects as well?
Yes, it does. Semaglutide.
So Ozempic.
Mounjaro.
Right.
Mounjaro too.
Correct.
Mounjaro is released just for weight loss, right?
Correct.
If they basically decrease your blood sugar also.
Right.
I mean, they act in three ways.
Decrease your appetite.
They decrease your appetite, they decrease your gastric emptyings, and therefore decrease your appetite also.
Right.
And they stimulate the pancreas to secrete insulin.
Right.
To decrease your blood sugar.
Right.
So because of this, they are anti-aging.
Okay. So,
I would-
indirectly they have an effect
Yes,
on
indirectly.
Okay.
So I would put them, and they're peptides basically.
Correct.
So there's a lot of things about how unsafe they are. Yes, in some very rare cases, it can cause pancreatic cancer. It can give rise to a lot of gastric irritation. But apart from that, the effects are also quite beneficial.
Nice. I wanted to ask you, and what's been your experience of using Botox and fillers? And why do they get a bad name? Oh, this person is looking good because he or she has used Botox. What's been your experience with that? And can you sort of demystify to the common audience what is Botox and what are fillers?
Okay. So, I was associated with Botox 22 years ago, before it came into India.
Okay.
I was in London and I was trained there for Botox. Okay. So, I've gone through the whole thing of Botox. Now, my thing on it is that girls who come to me, mainly girls, men also come, a lot of men come too, but it's mainly girls and older women which come to me. I have only one thing to say to them, that Botox is good. It relaxes your wrinkles. It makes you look younger. Straight away you look years younger after applying it. But if you start very early, then what happens is you have to continuously use it every few months. Botox only lasts from 3 to 6 months. And you have to keep...
How does it work?
It actually relaxes your muscles.
Okay.
It paralyzes your muscles.
Okay.
Okay, so your wrinkles go away where you inject them. Wherever you inject it.
Okay.
It just relaxes your muscles, so you have a calmer look.
Okay.
So the effects are... But then you have to keep using it. And what I'm finding over the years, since I've used it for so many years, is maybe there's some antibody build up in the body. Maybe it's, then you have to constantly use it again and again. That's all.
Okay.
So I say, yes, use it because it does wonders for you, for your self-esteem. It
Right.
makes you feel good, look good. So use it. But don't use it so often. And don't start so early.
Right.
Just wait for a little. We are under too much of societal pressure
Sure.
to look good. Today, that's it. In the office, you have to look good. That pressure needs to go off now. And so you begin later and use it when you really want to use it.
Right.
Similarly for fillers.
Right.
Fillers are hyaluronic acid.
Okay.
They can lift your cheeks or face.
Okay.
They can fill your face to make you look younger. A
Okay.
fuller face looks younger.
Okay.
Basically, that's how it works.
Okay.
Right? And they, of course, last longer for 1.5 years to 2 years. I call it magic. And though as a doctor, I don't like to call anything magic, but because they transform you in.
Sure.
And why not? But the problem why they've got a bad name today is because people are overdoing it. I can't blame the doctors. It's the patients who want everything filled. I mean, when you're born with certain shape of lips, you want to look like Angelina. You want to have lips like Angelina Jolie. They come and tell me, please, can you make my lips? But that's not going to suit you.
Actually, people come and tell you.
Yes, they come and show me pictures of what the kind of lips they want. And I'm thinking to myself, oh my God, that's going to look so horrible. So I don't get pushed into it, but other doctors probably get pushed into it doing it. So I don't blame the doctors. And that has a terrible effect because God made you a certain way. He gave you certain features. You can just enhance it a little if it has gone down, because as we age, everything sags. It all comes down south, right? You can lift it a little. You
Okay.
can put it, but it should be done naturally and gracefully. Nobody should be able to make out that you put in anything. And yet you look younger. So people say, wow, you're looking younger, and that makes you feel good. So that's how it should be. But that's not how it is, because people are asking for more and more.
Coming towards the end, I'm going to ask you, a few things like a rapid fire, and you have to just give me a quick one-line answer.
Okay.
These are like biohacks. So
Okay.
IV drips and plasma exchange. Yes, no, maybe.
Plasma exchange, no. IV drips, yes, sometimes. for fatigue, patients who are very fatigued, etc. I mean, this has been going on since 1960.
And what do you put in these IV drips?
It depends. A Myers cocktail can have vitamin C, it can have magnesium, it can have calcium, all these vitamin B12, etc. It can
Right.
have, or you can give glutathione
Glutathione drips.
because glutathione orally doesn't really work. Glutathione is the most powerful antioxidant in our body, so of course it's very good for our cells, and not everybody needs it, but it's good. It's very good for the liver cells too, and the side effect is that it makes you fairer. So everybody around wants to use that as the effect. The reason I do give it is because it works internally too. If it was only external, I don't think it'd be worth giving.
And these are only to be done supervised by a professional, right?
Definitely.
Not at home.
Definitely not at home.
Not at home.
Okay? They can have terrible side effects.
Right. And do you offer them at your clinic?
I do.
Okay. What about things like ice baths and hyperbaric chambers?
So ice bath per se for longevity, we're talking about anti-aging here.
Right.
Ice baths stimulate your brown fat, okay, which helps with your metabolism.
Sure.
Right, which can help you lose weight, etc. But as far as anti-aging, yes, okay, so indirectly it can all link up like that, but not so hot.
Okay. Let's come to the end, and it's been a great conversation. Tell me any one widespread myth about anti-aging or about skincare that you wish people would just stop believing.
I wish they would stop believing that all these expensive creams can change them. Okay? They can't. If you have basic things like peptides are very good for the skin. Peptides are another thing which is a hot topic these days. You have peptides for the skin. You have peptides for internal anti-aging. Like they help with your mitochondria, they remove your senescent cells. Okay, so you do have different types of peptides.
And how do you access these peptides commonly? I mean, what's the way to get?
They're available in your creams. A lot of creams have it.
But
So skincare, it's there available. But the other peptides which you inject IV are not approved as yet,
Okay.
and they can be dangerous.
Okay.
So till they have a full approval, I don't think clinics should be using them.
Okay. Pick the creams correctly.
Yeah.
Let me put it that way.
No, you can use homemade things. So my whole thing is to go back to basics.
Okay.
A very old turmeric and rice powder, etc., can all help you with your face.
Okay.
Right? But as I said, the glow has to come from inside. Okay. And yeah.
Okay. So coming back focused on you now, tell me rapid fire
Right.
one beauty ritual you never skip no matter what.
Sunscreen.
Okay. And what's the SPF percentage that you put on? 50. And this is and it's being used anytime you step out of the house?
It should ideally be used 4 times a day.
Oh,
Right, because most of the sunscreen lasts only for 2 hours. But you
Okay.
have some longer lasting sunscreens which can be used longer.
okay. And what's the benefit of that?
So it prevents the damage of the skin from the UV.
Okay.
The
So
UV
sunscreen, okay.
Yeah.
That's okay. One treatment
Light.
you think is overrated, and I know you spoke about creams, but is there anything else that comes to mind that you think is overrated?
Well, I think maybe PRP is overrated.
Platelet-rich plasma.
Yeah.
Okay.
Exosomes, on the other hand, these are little extracellular vesicles which act like cellular. They help cells communicate with each other,
Okay.
and they help with the repair of cells. Those I find much better for the skin and the hair.
Okay. And for you, if you have to pick morning or night routine, which is non-negotiable to you?
Well, the morning routine,
Morning routine.
Yeah.
Okay. Which is?
which is just basic cleanser,
Okay.
vitamin C cream,
Okay.
and a sunscreen.
Okay.
And if you ask me for the night,
And intermittent fasting.
definitely intermittent fasting.
Okay.
Okay, if you're asking me.
Okay.
Yes.
And sleep at least 7 to 8 hours every night.
Yes,
Preferably with magnesium. Okay.
definitely with magnesium.
Who's your anti-aging inspiration? Someone who's aged gracefully and who has inspired you? Your mom?
Oh yes, my mom.
Yeah.
But yes, you're so right.
I've seen
I
her.
wouldn't have thought. I was going to say Hema Malini.
No, I've seen your mom. So for
Yeah.
the last so many years, and
Right.
I think she's just graced so ageful. aged so
Correct.
gracefully.
Correct.
Yeah.
But I was going to say Hema Malini.
Okay.
You know why? Because she has such a purpose. You know, she is on the go all the time.
Okay.
I watched her as an MP. I watched her as a dancer.
She still dances.
As an actress. Yes.
Yeah,
I was in Mathura recently, and I gave a lecture to all the
Nice.
village people which she had gathered there.
Nice. And let me end this by asking you, if you wanted to start something tomorrow for our audience, just 3 simple things that they could start with. The very basic bottom of the pyramid, 3 things that anybody could start with from tomorrow.
Okay. Give up sugar.
Okay?
Start walking.
Okay?
Start sleeping.
Okay.
3, right?
Yeah. No, if there are more, so because
I could go on
I
and
don't know
on.
how easy it's going to be to give up sugar for Indians.
Yeah.
Walking, I completely agree with you.
Okay, at least lessen the sugar.
And how do you, sleep better? Let me put it that way, right?
Yes.
Right. Okay. Great. Change is the only constant in this universe, and aging is one such change. Inevitable, yet filled with possibilities. Dr. Banerjee, thank you for sharing your wisdom and reminding us that longevity is not just about adding years to life, but adding life to years. And to our audience, I leave you with this thought. Aging is not a battle to be fought, but a journey to be lived with awareness. The question is, how gracefully will you flow with it? This was Exceed the Brief. I am your host, Dr. Sanjay Arora. Until next time, stay curious, stay inspired, and keep exceeding the brief.